Alright, I'm going to be doing Gillet's test and SI compression and comparing and contrasting them and demonstrating them for a SI syndrome. So first, we have our patient on their side, and this is for SI compression. He's on his side. I want to make sure to put my hand not on the acetabulum, but on the iliac crest, and do a straight lateral to medial pain. And pain generated with this can either indicate sprain and strain of the SI joint or the pubic bone. So that'll give us an example there. For Gillet's test, can I have you stand up and face that way? Face that way. Actually, this way. So Gillet's test can be used to see segmental dysfunction in either the upper or lower pole of the ilium. So for the upper pole, I'd be contacting the PSIS and the S2 tubercle. And with the lower pole, I'd be contacting the PIIS and the S4 tubercle. So we're first, as we go here, one hand is going to be on the PSIS and the other hand on the S2 tubercle. I'm going to ask Christian, can you please flex this right leg up to 90 degrees? All right, and bring that down. And what we're wanting is to see his ilium from the PSIS come posterior, inferior, and medial, since the joint plane is angled, and with S2 staying put and the sacrum staying. As I come down to the PIIS and around S4, I'm going to have you do the same thing, Christian. And we're looking for the PIIS to come in and translate more anterior and inferior. So this is to assess the flexion of the right side. If I wanted to assess extension of the right side, I again can do the PSIS on the right side and the S2 tubercle and have Christian flex his contralateral leg, his left leg, to 90 and back down. And so for this one, what I'm trying to feel is the S2 tubercle of the sacrum to come into extension or base posterior. The same thing can happen with the PIIS and S4, but noting that the sacrum has a curve right around S3. So come in there, and I'm still going to want to feel it contralateral leg up to feel for extension, and back down. All right. To compare and contrast the both, SI compression on his side gives us pain and a slight either pubic bone or SI area, whereas Gillet's test is going to give us a specific area of segmental dysfunction.